Okay, so good morning. I'm just going to give a bit of an overview of the current trends in STIs, BBVs and HIV for the 12-month period that ended in the current reporting period to the third quarter of this year. So first of all, this looks at the notifications that we receive large numbers of. So chlamydia, gonorrhea, unspecified hepatitis B and unspecified hepatitis C have actually stayed quite stable over time. Newly acquired hepatitis C, we saw a large increase in the previous 12-month period. That was related to notifications amongst Aboriginal people from prisons. Since then, though, the notifications have remained quite stable. Newly acquired hepatitis B notifications have also remained quite stable over time. Where we've seen our largest increases is with infectious syphilis. Now, about half of our notifications for infectious syphilis are still amongst Metro MSM. What's driving the increase in infectious syphilis notifications, though, is the notifications in the Kimberley region. So that's related to an outbreak that started in Queensland around 2011, and since then it's been spreading across the top end of Australia. And we received our first notifications related to that outbreak in the first quarter of 2014. Prior to that outbreak, there was an average of about 5 notifications per period in the region. In 2012 and 2013, there were no notifications. In the current reporting period, there were 34 notifications. There's been no concurrent increase in other STIs and BBVs in the region. The majority of the notifications are amongst Aboriginal females, and fortunately, we've had no associated cases of congenital syphilis. So I'm going to cover HIV today because Lucky Byron is still away on leave. He'll be back on Monday if you want to pester him though. So over time, the HIV notifications have really fluctuated from period to period. In the current 12-month period, we had 129 notifications. That's 15 less than the period before. So if we look at the crude rate of notifications in WA by sex over time, the rate of notifications amongst men increased overall by 38%, and there was a 15% decrease to the current reporting period. Amongst females, the rate of notifications decreased to the 2012-13 period, and since then the notification rate has remained fairly stable at around 2 notifications per 100,000 females. If we look at the number of notifications by exposure category, obviously the majority of our notifications are still amongst men who have sex with men. There was a large increase to the 2013-14 period, but since then the number of notifications have remained relatively stable. Likewise, the number of notifications amongst female heterosexuals has also remained quite stable, but there was a 13 case decrease amongst heterosexual males. So the next couple of slides will look at the number of HIV notifications by exposure category, place of birth and place of acquisition. And first up, men who have sex with men. So the majority of notifications are still acquired in Australia, but there's been a slight increase in the number of notifications who were born overseas and acquired their infection in Australia. The majority of those were born in Asia, the UK and Europe, but there's no particular trends that we've noticed within that group. A bit of a confounder there is that a lot of them are permanent residents or citizens who have been in the country since they were quite young. So next up, male heterosexual cases. The majority of these are still acquired overseas, although there's been a slight decrease to the current reporting period. Of those who were born in Australia and acquired their infection overseas, the majority acquired the infection in Southeast Asia. Of those who were born overseas and acquired their infection overseas as well, the majority were from sub-Saharan Africa. And with female heterosexual cases, again, most of them are were overseas born and acquired, and again, that was mostly from Southeast Asia and sub-Saharan Africa. And the numbers have remained quite stable over time for women. And lastly, looking at the notification rate by Aboriginality, the rate has really fluctuated over time. but it's important to remember that rates are really sensitive to small numbers, and we've only had between 0 and 6 cases over the last 5 periods. So that's a total of 15 notifications. The majority were heterosexually acquired and were in the non-metropolitan areas.